If you think about the death of George Floyd and the protests and civil unrest that sparked, not new issues at all, but things we're now taking on. Could you maybe just speak a bit about our role relative to that social unrest, but also come at it from the point of view of social inequities around healthcare?
Sure. And I'll start by saying I know how committed you are to this work around making sure that every human being is treated with dignity and in an inclusive fashion. But I'm going to amend your language a little bit. This was not the death of George Floyd. He was murdered. He was murdered like hundreds and thousands of other black people have been murdered in the United States over decades and centuries. And it's wrong. I know you know it's wrong. You can hear the passion in my voice. It's disgusting that this happens in the United States. And I believe that the inequities associated with George Floyd's murder, in association with the disparities in outcomes people of color, particularly black people and Hispanic people, have experienced during COVID, has put a very fine point on how unjust many parts of our system are. I don't mean our system specifically Intermountain, but we're part of the larger society. And I feel like we have a moment in time to make a real difference. And it's actually very exciting, and it's right. And I have been so enriched by the listening that we as a team have done with a variety of our caregivers who have generously shared the experiences they've had. And many of them have been great, but boy, some of the abuse that our own caregivers have experienced at the hands of fellow caregivers, at the hands of patients, at the hands of society, is really shocking. Absolutely shocking. Now, it does sound like the majority of the bad events internally have largely been unintentional, not entirely, but largely. So I'm optimistic that we can make change relatively quickly. But big part of that change is making sure that we have a workforce, and people have heard me say this before, that represents the communities that we serve. Yeah. And our communities have changed a lot, and Intermountain hasn't changed nearly enough.
Yeah. No, I appreciate you calling out the words, because language matters hugely.
Language matters.
And, it truly was a killing. It was a murder. As we go into this work in a much more meaningful way, perhaps, than we've been able to in the past, getting beyond the language, which, as we say, is important, how do you see us transforming as an organization, not just as our caregivers and the experience we bring to ourselves, but also for the patients and communities we serve?
I think that institutionally, we have started the process over the last couple of years of being an upstander. We need to do a lot more of that. And I think each of us as caregivers must stand up for doing the right thing, and we have to learn. And then we also have to work hard and intentionally to improve the diversity of our workforce, and not only to make it more diverse, but to make it more inclusive. So it's easy to fall into the numbers trap. It doesn't help any if the people who join your team don't feel included. And then finally, and this is tied entirely with what we do in terms of providing health care, we have to make sure that our health care is equitable. Even this morning, there was an article that has come out from the American Academy of Pediatrics main journal, which describes increased death rate in black children who are relatively healthy after relatively minor procedures as compared to their white counterparts. There's nothing genetic about this, right? Something is wrong in the system. It happens to be true for black women who are giving birth. They're much more likely to die than white women who are matched for socioeconomics, et cetera. So we have an opportunity, and Intermountain is as good as any organization that I'm aware of at seeing a data-driven problem, and then with good hearts and great minds and excellent execution to begin to rectify it. And I'm confident that we will do exactly that because it's right.